I'm Dr. Stephen Hodak. If radioactive iodine has been recommended for treatment of your thyroid cancer, you'll want to review this video in which we discuss what radioactive iodine therapy is and what you need to know to be prepared for your treatment. Radioactive iodine therapy for thyroid cancer is not necessary for all patients, and in fact, if you have low risk or early stage cancer, radioactive iodine therapy is almost never necessary. So before proceeding with treatment, be sure radioactive iodine is right for you by having a full discussion with your physician. Following a thyroidectomy, radioactive iodine is generally necessary to destroy all remaining thyroid tissue if residual cancer is either known or suspected. Why iodine? If you watched the previous video on thyroid hormone replacement, you may remember that iodine is a key building block for thyroid hormone production. And because of that, thyroid cells, including those from most thyroid cancers, have the highly specialized ability to absorb and concentrate iodine. The small amount of radioactive iodine used for treatment can therefore achieve very high concentrations within thyroid cancer cells, sufficient to kill the cancer without excessive exposure to the rest of the body, hopefully leaving the patient disease-free. Before you start the treatment protocol, you'll need to be on a low iodine diet for 1 to 2 weeks. The low iodine diet depletes iodine within your body, which will enhance uptake of the radioactive iodine, improving the effectiveness of treatment. A link to a suggested low iodine diet is provided here, and you'll remain on the low iodine diet throughout the entire protocol until after the radioactive iodine is administered. You may also need additional blood tests before you start the treatment. Reproductive age women will require a negative pregnancy test, and thyroid function tests, as well as baseline testing of a tumor marker called thyroglobulin, along with other blood tests, may also be needed. Women should also not be breastfeeding prior to radioactive iodine, and breast milk production should be completely stopped for at least 4 weeks prior to receiving therapy. Once you're on track and correctly following the low iodine diet, you'll be ready to start the actual treatment protocol. Though there are several ways this can be done, the process typically occurs over a 5-day period. The first step in the actual treatment is to elevate thyroid-stimulating hormone, or TSH. When TSH is elevated, the thyroid's metabolic processes are increased, and these include iodine uptake. So getting the TSH sufficiently elevated is a critical step in ensuring that the absorption of radioactive iodine is maximized. For thyroid cancer treatment, TSH is usually elevated by injection of a medicine called thyrogen, which is human recombinant or synthetic TSH. A single daily injection of thyrogen on days 1 and 2 of the treatment protocol will sufficiently elevate TSH and prepare you for the radioactive iodine therapy. Each daily injection takes only a minute, and you can return to work or your normal activities as soon as the injection is completed. On day 3, a low-dose radioactive iodine whole body scan will be performed. This will require about a half a day and involves the administration of a very small amount of radioactive iodine, followed several hours later by imaging that uses the radioactive iodine's energy to create a whole body scan. The radioactive iodine uptake in these images will confirm where any thyroid cancer is located in your body. Assuming there are no areas of unexpected uptake, at most centers you'll also receive the radioactive iodine treatment dose later on day 3. Day 4 is usually a day off, but you will need to follow radioactive iodine precautions, which are discussed below. On day 5, you'll need to go to a lab and have blood drawn for another measurement of the thyroglobulin tumor marker. Once this blood test is completed, you will discontinue the low iodine diet, resume normal meals, and your treatment will be done. However, there's one additional important step you must complete. About a week after your treatment, you'll return to the nuclear medicine department for what is called the post-treatment whole body scan. Once again, using the retained radiation in your body, images demonstrating where iodine is concentrated will be produced, but this time with the significantly greater energy from the therapeutic radioactive iodine dose, the images will be far more sensitive and therefore far more helpful. These images are key for correctly assessing the extent of your thyroid cancer and are very important for determining the type of follow-up you will need. So be sure to complete this last and very important step. Throughout the treatment process, be sure to remain well hydrated and ensure that your bowels are moving regularly. Both of these will help you clear radioactive iodine that is not retained by the thyroid tissue in your body. After you're treated with radioactive iodine, you'll need to follow radiation safety precautions to ensure that no one in your household or the public is exposed unnecessarily to the radioactivity in your body. You should receive these instructions in writing, and they should be fully discussed with you well prior to your treatment. The amount of time you'll need to observe the precautions will depend on the amount of radioactive iodine that is used. The most stringent precautions will apply for the first 72 hours, but additional precautions often apply for up to 1 to 2 weeks. Though there will be many specific restrictions, the most important way to protect others is to remember the concept of time and distance. Keep the time you spend in close contact with others to a minimum for the first 72 hours after treatment. That means for the first 72 hours, restrict contact with others to no closer than 2 meters or about 7 feet as much as possible. If closer contact with members of your family is necessary in the first 72 hours, limit contact to no closer than 1 meter or about 3 feet for no more than 45 minutes daily. You should also sleep alone and have no sexual contact for the first 72 hours after treatment. Prolonged contact with pregnant women and young children should also be minimized for at least the first week after treatment. An example of some of the additional detailed instructions you may receive is listed below. Delay return to work. Do not share eating utensils or prepare food for others. Sit on the toilet when urinating, always flush, and ensure that the seat and bowl are completely clean after each use. Shower or bathe daily. Rinse the bathroom sink, tub, and shower thoroughly after each use. Wash soiled underclothing in a separate laundry load. And importantly, carry a card or letter from the treatment facility noting that you've been treated with radioactive iodine if you plan to travel by air, bus, or train, or if you plan to visit federal buildings in the 4 weeks after your treatment. Residual radiation in your body is sufficient to activate very sensitive radiation detectors in these locations. Though radioactive iodine is generally safe, you should be alert for possible side effects that may occur. Mild nausea can occur immediately after taking the radioactive iodine. Anti-nausea medications prescribed by your doctor can prevent this. The salivary glands located in your cheeks can be injured by radioactive iodine, which can cause swelling or pain. This can occur immediately after or any time within the year following treatment. Though uncommon, mouth dryness due to salivary gland damage or excessive eye tearing due to tear duct injury may occur any time from days to months following radioactive iodine treatment. Drinking plenty of liquids around the time of the radioactive iodine therapy can reduce these risks. A temporary change in taste, known as taste distortion, occurs not uncommonly after radioactive iodine treatment. This may make food taste metallic or somewhat unappealing, but this generally resolves within a few weeks on its own. Though serious side effects after radioactive iodine are uncommon, if you have side effects after treatment, you should notify your doctor. We hope this discussion is helpful and will make your radioactive iodine treatment easier to understand. However, it cannot substitute for a thorough, informed discussion with your treating physician. Get any questions you have answered and make sure you understand all the important information about risks and benefits of treatment, as well as post-treatment precautions necessary to minimize risk to others. Good luck with your treatment, and we wish you the best possible outcome.